To piggyback on what you're saying, our group was a mixture of facilities as well as central office personnel, and they really like the Montgomery County plan of phasing everything in. And then we talked about how we could have, instead of having that AA schedule, once we start phasing in, 2 consecutive days for students coming in, and giving teachers the option of being virtual or being here in physically in the building. Because I know from our staff, there's teachers who are itching to get back in here, and they're like, can we tutor kids? I mean, they're constantly contacting us. Well, can we work with our high-risk students now? We're like, no. But in those teachers who are fearful of coming in, so there is a mixture here at Tucker who wants to participate and how they want to participate, but they all want to work, but just to what capacity.
Can I just add something that I was thinking about in my meeting, where we talked a lot about the transportation. We had a transportation kafaya in the group. And so we discussed, the capacity of the buses, different permutations of that. And one thing that occurred to me in this was that, given the fact that we can only fit a certain small number of students on the buses, and there's concerns about cleaning the buses between each route, who would do that? How long would it take? It just occurred to me that arrival and dismissal would easily take up half of your instructional time. And how does that serve the students and the teachers? Would it be better for us to do remote, because we can have more valuable instructional time in a remote environment than spending half your day coordinating students arriving, finding something for the students who are there to do while you wait for the rest of your students to show up? The logistics of it will be very difficult, and we would lose instructional time.
That was something else that came up in the group that I was with. One of the gentlemen, he said that he worked with transportation before. He's a community member. And one of the concerns was that point exactly, with the amount of students. For example, he was wondering if 10,000 students can ride the bus, but then there are only 6,500 students in ridership. Out of that 6,500, how many of those students would be willing, if we open on any level, hybrid or whatever the model was, to come back and ride buses? Because that could also be data that can inform how we routed or worked with transportation to support the model. I think, and the last point that I'll make is, if we're able to ensure or work to ensure health and safety following guidelines, I think that that is something that can contribute to trust in the community, no matter which way we go. I think, honestly speaking, the virtual model in the fall, and I'm thinking Q1 and 2, and then moving into the hybrid model after that, is what makes the most sense, in my opinion, of building trust as we go along.
And I concur with you with that. And we were also talking about, like, we had Brent Place. Brent Place, we put the babies on the bus. But in reality, the only reason why they are not walking is because we need to have a crossing guard at Etzel and Pickett. And would those bus riders turn into walkers? That could be an option, and that will eliminate a route for us. Because Mr. Pascal has done the math and said it was cheaper to get a crossing guard there than there is to have that bus running from Brent Place.
Yeah, and we were.
Sorry.
Go ahead, Alice.
In our group, we were kind of talking about what will happen, if teachers get sick, students get sick, substitutes, how long are you supposed to stay out when you have symptoms? And it just seems like it's going to be a huge problem to keep up with all of that.
I had another feedback thought on that was brought up to me by a coworker, which is, let's say that, what about truancy issues? When a student maybe needs to self-isolate for 14 days, 2 weeks, and then again, maybe in another month because of certain circumstances outside their control, because of, like maybe another family member has become ill or is showing symptoms. It's just the challenges that those students will face, and not to mention the potential, I guess, black mark on their record for not, attendance. If you don't attend a certain number of days, you start getting in trouble. Those are things that if we do reopen and have physical in-school work, we'd have to consider, are we going to just let that fly? And what are we going to do to support those students who need to do the self-isolating?
All good points, and this was a good, thank you guys for reporting out what your group talked about. So now that you've kind of heard a little bit of the insight about what was discussed in each of the groups, let's take all that information and put it back into our lane from the HR perspective and how would it affect staff, and talk about that aha, an insight that you've had based on what you've heard that should be impacting our decision making or the questions that we need to be formulating. I think Alexander has put a couple in there that we've, through the discussion that we've had, but is there something that we have missed that's an aha regarding our staff and teachers and those people who would come back in the building? And I'll start with the one that came from my group, and just in thinking about scheduling and of course, I'm back on how does it affect our staff who do not live in our jurisdiction and have school districts that have all of these varying plans. Will that affect their ability to report to work in person, given the schedules that their children will be on in other school divisions? So that's kind of the aha, like we really have to be aware of what our employees are facing in their, resident area.
And what I liked what you said, and I know, what page are you on, Duncan?
It's page 2. It's where it says insight.
Oh, I see him. I see him.
Yes.
I see him.
Okay.
I'm not sure. Building trust is very important, and I think you said it. And building that trust of our faculty, of all stakeholders, but also letting our staff know that we are there for them. I don't know if that piece has been translated to them as of yet. I don't know what type of messaging has been sent to our staff as far as that trust, building that trust. And I agree with that. Phase-in will help increase that trust.
And what I would like to do then is just, based on what you just shared, I think we can actually take that and put that into an action column.
Okay.
And the action really is, how do we formulate a communication plan that builds the trust among staff and is clear and explains what our intent is in any decisions that we make?
So one of the big components that we were discussing in our group was the social emotional aspect, not only for the students, but for staff as well. And I think it goes back to one of the earlier iterations when we talked about flexible staffing, as far as maybe even co-sharing positions, repurposing staff, so that we can have the hybrid. We need the in-person. I hear what you're saying about phasing in, but I think that we do need to look more seriously at this hybrid. The fact that students need to be back into a structure where they are interacting with other people outside of their own little bubble world. And I think that the sooner we can have that with the staff that is comfortable in doing this, the better it will be to support the social emotional well-being of our students and our staff as well. So I wanted to make sure that we get that out, because I'm hearing phasing, I'm hearing let's all be remote, but one of the discussion points that we had was middle and high school kids are just as fragile as the elementary and do need to have in-person interaction with peers and with adults. So we can't, and they were the ones that were least compliant with the online learning this Q4. So that's also, we don't want to lose them as well.
Well, something that someone in our group, Jody Peters, brought up is the reason why they were not is because there was no accountability. They had the option to participate or not to participate. So I just that's why there was a lack of participation. And whereas though I'm just going to let you know, my son personally, he's in Prince William County with his virtual. When he realized he could improve his grade and he had that carrot there, he worked and his friends worked to improve their grades. So I'm wondering, I understand what you're saying, but also is that accountability measure for our high school students as well? Because I think Montgomery County is saying they're going to be virtual 9 through 12, but I just know my son is climbing the walls. He wants to be social. You're right.
In our group, we were talking about kind of like also the effects on, like I said before, the inevitable sicknesses that are going to come up. And are we really going to be able to stay open because of the staffing issues? I would say the staffing issues of like people being sick and having to be out and having to quarantine for any symptom. And so then are we going to have to close again? And then what effect is that going to have on students, just like these constant changes of what's happening? And I think people are also kind of in denial. Like everybody wants to go back. They want it to be like it was before, and it's not going to be like it was before. And I don't think people totally get that yet.
Can I piggyback on what Allison said? Because, you know, I understand people say the need for kids to have social interactions, but as she stated, it's not going to look like it did before. I feel like, you know, the fact that kids are like, oh yeah, I want to, you know, do such and such with my buddy or whatever the case may be, that's going to have to look totally different. The physical layout of the classroom is going to be totally different. The type of protective gear we have to wear is going to be totally different. So while I understand the need for kids, you know, wanting or needing social interactions, those social interactions are going to look totally different than what they did before we got into this pandemic. And we need to be able to deal with how both staff, students, and families deal with that.
So Don and Allison, to kind of take what you both have said and formulate it into the wondering, a question I have is, so we can add it to that category and make sure I'm capturing this correctly, is how do we define social interaction for students? And that's a question that I'm answering because we keep saying that this is about their social and emotional, but have we defined in our current climate and environment what that could look like? Because our brains are automatically going back to what we know.
Yep.
And what is comfortable, but we really haven't thought about what is it that the child needs and how can we meet those needs in a different way. And that may not be the question that we're charged with answering. That probably is coming out of that SEAL team with curriculum and instruction, but it's something that we could be asking because that can help us decide or make recommendations about how does this affect staff and what tools or resources or strategies do we need to be providing our staff in order to meet those needs and still meet the safety concerns that we have.
And that kind of goes back to the point that I was thinking about, Sandra, when you were speaking, because from a staff perspective, one could argue because of COVID, it's not safe for me to go anywhere and do anything, period, no matter what the CDC or anyone says. But then the guideline says, well, it's safe, according to the definition, for you to now return to work as long as you maintain 6 feet distance, you wear your, your protection, your PPE, and you are social distancing. That's the guideline. So in terms of that, I think going back to the plan, I'm thinking about the plan you brought up about communicating so that we can rebuild trust. I think our plan is a communication to the community and to our staff. These are the considerations, and then these are the expectations, because safety and security, social distancing, and all of that is going to look different now. We can't, I love the point you made. We keep going back to what social interaction once looked like, but we have to be clear about what, as a district, we are perceiving these things to be now, because that's what's governing the decisions that we're making.
Absolutely.
And I do have a question for you that I'm switching gears real quick about staff. So far as contact tracing, say if we're in the building, someone in our building gets COVID-19, we've come into contact with that person, we are all out for 2 weeks. What is sick leave? How is that charged? Even if the person was, even if, say, a person was out with their family or at the grocery store and contracted it, even off campus, that 2 weeks of quarantining, how is that leave charged to the staff member or staff members?
I actually sent you all out
Yeah, I was gonna
a
bring that up.
email this
Is it long
morning. Is it? Yeah, I know it's pretty long, but it has some of those questions that we need to think about in the HR lens. And
I'm sorry, I didn't look at that email. I'm sorry.
it's okay. No, I know I sent it out kind of early this morning. And it does have some questions on there that are specific to what would we need to be looking at in terms of our current policies related to health leave, FML, how leave is charged, because you're right. Those are unanswered questions.
Absolutely.
And the other thing that you brought up that's really important is think about ratios for a minute. We have more students than we have adults that are actually in front of the classroom or support staff. So, and the adult population is the one that's more vulnerable. It's not the student population. So when you take out a teacher out of the equation, what happens then? You know, if we're back in the building, is that going to kick everyone to a remote situation? Is that going to kick everybody to a hybrid situation? Because the ratios are going to be off. Even in the presentation this morning, which I didn't know that that's what they were considering, but they did some of those ratios based on, even in the kindergarten classes, 1 adult per classroom. And so what happens when that 1 adult
Goes down.
Yep.
Yeah. So I think that that is something that has a huge impact from a staffing, from a staffing lens. And we've had group discussions in this group prior to Allison and Miss Kelly joining us, but we've talked about what does that look like for substitutes coming in? What does that look like for encore teachers? So those are things that we're going to have to tackle depending on which model is the preferred model for the district.
Yeah, that's kind of like one of my big concerns, especially, I've recently had 2 kids, so I don't have sick leave saved up at all. So, 1 quarantine, it would be knocked out, my sick leave. And then also
quarantine. You don't have to use your sick leave. There's the emergency sick leave, paid sick leave that's in effect for 2 weeks.
But do you realistically too, Han, after 1 outbreak, you have 1 teacher that maybe is in this quarantine situation. You're talking again about the contact tracing. What happens when it folds over into another teacher or classroom? You could potentially have someone who exceeds 2 weeks, depending on how it is transmitted through a building or location. And then what happens then? So I do think it's still a question that we have to address, because in the worst case scenario, it could extend beyond 2 weeks.
And all of this is contingent on the current guidelines from CDC and the health department. All this may be moot point moving forward, depending upon whether the whole of Virginia shuts back down again and so on and so forth. Or if we get the testing, or if we get the testing for antibodies and find out that, the majority of us have been asymptomatic and actually have been exposed and have it and are walking around giving it to others. So, I mean, there's so much more beyond what we're doing. And I feel like sometimes we just keep talking over things that we really have no control over, because come tomorrow or the next day or the next week, it all changes again, because 6 feet is now 3 feet, masks, no masks, take this magic cure, do this and whatever. So I guess if we keep it in general terms, because what you just said, Sandra, the entire building just shut down. Right. During the course of the day in an elementary building, every one of those people somehow have been exposed to someone else. So I don't know.
Well, I was going to say also, just by nature of some teachers' positions, they might have more exposure. I mean, as a special education teacher, I'm in and out of classrooms, various classrooms, in order to provide the services for my students all day long. So I just think sometimes by nature of the position, I know they say 1 teacher per classroom, but if the IEP says that that's not the way it's supposed to be done, then I have to adhere to the federal document. So sometimes by the nature of the position, people will have more exposure, because they do have to be in and out of various classrooms throughout the course of the school day.
We'll probably have to do amendments or addendums to all the IEPs because 2 adults were not going to be in the classroom. So now all the services are going to be conducted in a different location, to be determined, because we don't have those locations. So what now becomes the area and that we are providing services for either EL or special ed? What happens to our citywide programs? Our citywide programs, which have children 6 to 10 in smaller spaces with 3, 4 adults and so on. So there's a lot.
Dr. Wilkins put something in there. Please cross-check that only the person who tests positive and healthcare provider directs the quarantine qualifies for FFCRA.
Yeah, so he sent that to, you see it too, hon? Okay. That's something we can follow up on.
Yeah.
Okay, so let's do a quick look at what we have put in here for the wonderings. Are there questions? Because I think we had a lot for insight that we added, but for questions that we have outside of that humongous list that I sent you, based on our discussions today, are there any questions that we feel like we need answers to in order to move forward? And I keep saying, I know I keep like passing it off the buck on everyone else, but I really do think that the question that we have is, which is the model that we're leaning towards? Because a lot of what we need to decide is contingent upon having a better sense of the model. And that's, while we could have input into that, I'm still believing that that's not like necessarily our charge.
I just don't see how, okay, so if we reopen, I do not see how we're able to effectively develop policy that will give schools the opportunity to handle if a staff member comes in or a student comes in and they are diagnosed with COVID, they have to quarantine to the point that's been made already. And I don't even have to belabor the point, but like someone gets sick, they've exposed people, now other people need to quarantine. We could be in a position where we're down half the staff, the substitutes may not want to come in. I'm just struggling to understand from a HR, and I'm trying to see it through the HR lens, how we're able to fully like address that problem going back to school right now.
So I think that the wondering and the question that we can pull out of that, and since you're the scriber, you'll get to write it down yourself anyway, and that is, how do we best prepare for the staffing shortages that we know will happen? It's not a if, it is when. It's a when.
Yeah.
How do we best prepare for staffing shortages? And we don't have a good idea of how we're going to do that at this point. And that is I think that's the turning edge for us on reopening and going back in the building versus not.
Yep.
When you keep saying the Montgomery County one being considered, I don't really see that one being considered. So does that go under whatever column may be missing as to, are we even going to consider looking at the phase-in model that Montgomery County has voted on? Because you have virtual and you have hybrid, and I've seen Montgomery County being something a third, a virtual / hybrid.
And that's what I think that the point that our team made is that, like, let's not be just wedded to what's out there, and that
Right.
we are at an important point where we can decide to do something that's totally different. And that can be an option. And then I think for action steps, the main one we have is the communication for the next step. And I think the other action that kind of falls back on those of us who are in human resources is just ensuring or making sure that any changes to interpretation of CARES Act or anything related to COVID, yeah, that we are attuned to it. I mean, that's the main thing. So there's this constant alignment, because we want to make sure that we're being legally compliant as well.
And
So the
that,
compliance issue is important. So the action step for us would be to continue to monitor any legal compliance regarding staff.
and I was going to say that going back to the trust factor as well, you know, letting our staff know we are thinking about this, we are thinking about them, we are trying to mull this over, and that's part of the communication piece, that we are thinking of how we can make sure they're safe along with our students.
If I
So would
also
this
might
team be interested in at the, when plans are finalized, being part of like the discussion teams?
Yes.
They could be on Zoom, they could be,
Mhm.
you know, where we allow staff to come and hear from just the HR pieces of it, and then set up some type of thing on, you know, the website in terms of the FAQs or a depository of questions that we can answer?
Sure, because I think some of the work with this has to be clarifying for the community,
Mhm.
you know, how we are using these terms, health and safety, for example, you know, how this is being used to formulate our plan.
Mhm. And that it is being used to formulate the plan, because I don't know if that's being communicated. I just know that I had here at Tucker, we have a very, very vocal staff. As a matter of fact, Christina Borger was at the staff meeting, at the school board meeting last Friday. So it's just like, just answering their questions to make sure that they know we are pondering this.
And I want to say the transparency and sharing the staff results from the survey, how they're feeling. And I think that there were some concerns about the survey not asking or giving the opportunity for actually in-depth comments or commentary, that they really felt like it was like, this is it, this is all you get to say. And they're like, whoa, 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 time out. There's some other things you really don't want to hear from me. It's just like, check the box and we're done. So letting them know that they actually have a voice, because I think that right now they feel that they are not being heard.
Yeah, I think part of the challenge with that too, because I had the luxury of getting to listen to the whole school board meeting on Friday. And when Clint spoke about the survey, it made sense to me. I don't think that staff understood the phases of how the surveys were being run out. And this was really supposed to be, that first survey is more supposed to be like a temperature check to see where people's thoughts were, and that there is going to be another iteration of a survey that will come out in phases as this work is developed. But I don't think that that's been communicated to like all staff in a way that they understand. And that's the issue. So the communication piece still is.
I was going to just say it's communication. It would have been nice, like even today, seeing the phases and our sprints, that would have been nice up front. Okay, here we are. So we're in 2-week sprints to do these different components of this, of the actual work of the entire team. Like I have a PTA board meeting today and a PTA meeting on Wednesday. I want to share with parents, because they're inundating me with answers since I'm supposed to know it all and I don't know anything. That I want to say, look, this is a process, use your voice and so on. But the communication piece, some of the other districts have done a better job of communicating out the components of their plans and the timeline. And I think that we need to do that as well. That's so you can take care of that.
She's gonna snap her fingers.
It's 11:02, so I don't want to go beyond the time that you're allocated. Your time is valuable, and I know this does take up a lot of our energy right now. But I do want you for the next meeting to just plan ahead. We did really well in trying to get through that step 1, and I think the next meeting, as she indicated, Sema, we'll be looking at step 3, confirming the key decisions and scheduling interdependencies. I'm asking you all, because I think you have it in your link, if we can take a peek at some of the other workbooks, because those other teams are the ones that are formulating the actual decision making and planning, and we want to get a sense of what direction they're leaning, because I think that's going to help us do step 3. Because we really are not in a position to make decisions. I mean, we can make guesses, but we're not making decisions until we have a better idea about where the division is going and what plan they're leaning to. So if we can take a look at that between now and Wednesday, you have the link for Wednesday. This is always going to be the link for our team meet. And I'll do a quick closing checkout. If there's anything that we need to put on a parking lot for the next time we meet, or any closing thoughts that you have, we can do that now.
I just wanted to say I'm not going to be here Wednesday. I already have a pre-scheduled doctor's appointment, and I'm military. Getting into Fort Belvoir is so hard, so I cannot reschedule. I've been waiting a while for this one. So just letting you know that
Yeah,
I will not be here Wednesday, and that's the reason why I'm taking a sick day.
thanks. Anybody else want to do any closeout remarks? Thank you all for your participation, and I will see you on Wednesday. If you have any questions in the meantime, feel free to shoot an email to me or to the group, and we'll try to get those resolved.
Thank you, Ms. Hardiman, for this. It was
you.
awesome. Thank you.
Thanks. Have a good one.
Have a good day.
Bye.
Bye.